Every time I mention ketamine and RSI, I get comments about how ketamine is a cardiac depressant and we should be avoiding it in RSI. Well, I finally decided to dive into the literature. I gotta say, I am not convinced. The argument is that ketamine is a cardiac depressant, but that those effects are masked by ketamine's release of endogenous catecholamines. In patients who are catecholamine depleted, that cardiac depressant effect is gonna be unmasked. It's gonna have a profound effect on the patient's hemodynamics. The truth is that there's no real literature to support this, particularly in the doses that we are talking about. Most of the data here is from lab studies looking at myocytes exposed to ketamine. That doesn't really translate to real life. There's some sparse anesthesia literature looking at big doses of ketamine, somewhere in the 4 to 5 mg per kg range. Even if we believe the literature that ketamine is going to have a clinically significant effect on hemodynamics, we got a couple of things going for us. Number one is that we're using a considerably smaller dose, somewhere in the 0.5 to 1.5 mg per kg range. Number two is that if the patient is catecholamine depleted, we should be doing resuscitation prior to intubation, and that patient's going to be getting exogenous catecholamines, either norepinephrine or epinephrine. Overall, based on the literature that I have seen, I think that this cardiac depressant effect of ketamine is clinically irrelevant, and it should still be our go-to drug in rapid sequence intubation.